This is at the heart of the problem, and before carrying on, I would like to make the point that we really welcome this report, because this is the first report that we have had on mental health provision. It is something that is an objective appraisal. It has been carried out by an independent board, and it is of great value to us, because so far we have had, yes, of course, the experience that we have, the interaction that we have with people who are service users, relatives of service users, our own knowledge of the, you know, how the Ocean Views works, because we go there regularly and so on. But of course we didn't have anything like this. So this is the first thing that I would like to say, that it is of crucial importance to have this report. And then in terms of the cohesive system, yes, you need a cohesive system. You need to have a clear system where protocols are very clearly established, where everybody in the system, from the top person to the assistant nurse or whatever it is, knows what to do in any given situation. Our experience and the experience I've had a service user until recently in the family, close family. Well, my sister had been in the system for many years, so I know what it's like, that sometimes it's very much an ad hoc kind of response to a given situation, and we don't think that this is good.
The report and your statement highlight a number of areas of concern, from lack of admin support to monitoring of drugs and issues of consent. What are some of the most serious of these issues? You've highlighted, for example, that there could have been breaches of human rights.
Well, I think that there is a reference here in one of in the report that there were 3 patients that they felt had not where the procedure hadn't been followed closely as to establishing that they could be detained. So that obviously is serious. But I don't think, I mean, yes, of course, it's very serious from a legalistic point of view, but I don't think it's any more serious. Well, there are many other issues that are serious. I think that we need to have a system where everybody is getting the best provision that can be afforded them, whether they're outside Ocean Views, and of course this report focuses on what is going on in Ocean Views. And I think those in authority now need to work systematically through the report, making sure that all these things, all these procedures are established. These are situations, these are problems that have existed for a long time. Of course, this report was written last year. I think it was completed last March. It's only now come to the light. I don't know why it's taken so long. And I wonder whether now the next report, the 2019-20, should in fact be somewhere in the pipeline. We would be very interested in knowing what that report says, whether any of these issues have been addressed, whether any measures have been put in place, what exactly the situation is. We need to know that. I hope we don't have to wait another year to know what's going on.
The Society says that there are systemic issues it's been raising for years. Has anything in the report come as a shock?
Not really, no. I mean, nothing has come as a shock. I mean, of course, I didn't know that a number of patients might have been detained without the proper procedure having taken place. We can't know things like that. But in terms of other things, in terms of the fact that there wasn't a GP, there are no regular GP visits. Yes, they do call the GP in, but we know for a fact that sometimes somebody might be ill with some kind of, not a sort of an emergency situation, but somebody who needs to be checked, and maybe there's no GP available. And that obviously is of concern. They also raise the matter of the fact that there should be a pharmacist, not just for Ocean Views, but I think for Bella Vista and so on, so that they are there close to hand, and they could sort out any problem that might arise. Yeah.
And you've also highlighted that the delay in the publication of the report, and also mentioned the mental health audit, which you say has also not seen the light of day yet.
It hasn't seen the light of day. I mean, that was done last year. I can't remember exactly when it was now, but it was done about a year ago. It was carried out about a year ago, and nobody seems to know anything about it, which I find very strange. Even people working in the system don't seem to know what's going on. So I think, what's the point of carrying out an audit and then not publicizing it, or at least not even telling the people who work in the system? what's the point?
The report also highlights the strain on staff. Do you feel there's enough support for them, and are there enough staff to start with?
Well, according to the report, on the one hand it says that there is a full staffing complement, and then on the other hand it highlights a number of situations where, for example, somebody who is entitled to having a one-to-one, an escort outing, for example, one-to-one, cannot have it because the staff member needs to stay on the ward, or if the staff member leaves, then the ward is short of one person. So I don't see how that fits in with the idea of a full complement. I mean, I think that we have to consider that when one talks about full complements, these are decisions which have been made somewhere along the line at some point, and they have been adapted, but it doesn't necessarily mean that they do have all the staff they need. And I think the report also talks about the need to have proper training for everybody working in the system, including the assistant nurses, and that they don't necessarily get it, that they do it, I think the point was made that they do it sort of at work as you know, but they don't actually get the full training that they need. So I think, yes, I think the people working in the system are obviously trying to do the best they can, but there needs to be clear protocols. Everybody needs to know what you're supposed to do in a given situation. This certainly does not happen. Things change very much depending on who you're addressing and who is in charge, and I don't think that's right.
Have you noticed any improvements in recent years, and what changes would you like to see if not?
One of the improvements was certainly the creation of the liaison team, which means that somebody now who is in a crisis situation doesn't have to do what they had to do before, which is go down to A&E and then battle it out like everybody else. You know, now there are different procedures in place, and I think it's a much better system. It is something that we campaigned for years, that we did not think it was right that somebody in an acute situation with a mental health problem had to go to A&E and sit there for hours. But one of the recommendations is that they should get priority when they go down to A&E. I think that might be happening, and the report also talks about the possibility of having a special room dedicated to somebody in the mental health system. I would like to mention that something we've been campaigning for recently, which I think is at the heart of many of the problems here, is the lack of a plan, of a care plan or simply a plan, because it involves not just care when in Ocean Views and not just care when out in the community, but it's about supporting the person in relation to work possibilities, in relation to social activities, in relation to housing. The idea is it would be a holistic plan with clear objectives and periodical reviews, so that, you know, these objectives haven't been met, why haven't they been met, and that somebody is actually responsible for saying, well, this hasn't happened, or that did happen, or the person didn't respond appropriately, or we need to do something. But at the moment it's a bit of a, you know, it's all very much in the air.